While the name is about substance abuse, but during the years, more and more non-substance related research has been done in the framework of this association. And also in this conference, we will have just as many talks on behavioral addictions, including gambling, than substance related addictions.
But of course, anxiety, depression, bipolar disorder, other disorders and conditions can arise from gambling addiction as well.
It can, and on the other hand, also all these mental problems can be a predictor of gambling problems. So what we see that quite often different mental health problems, including anxiety, depression, or any other mental health problem, can be a reason behind, or can be a predictor, can something that a person tries to cope with these feelings. Then quite often addiction becomes something like what seems to be a solution for a short period of time, but in the long run, as you refer to it, it increases the problem.
And obviously Gibraltar has a very big gaming sector, so will there be a practical application to the research work that you're conducting?
Gibraltar is more a gambling provider country, so it's many companies are here. So it at first level we try to, and we initiate, cooperate with the companies here to think together about how we can reduce gambling related harm, or how we can contribute to any safer gambling intervention provided by these companies. But on the other hand, obviously, as all societies, the society of Gibraltar, the people in Gibraltar can also be affected by gambling related harm, and we think that all research also important for this, but also just generally, so it's not necessarily always have to talk about gambling addiction or harmful gambling. But there are really very different levels of involvement, and it's very important that at all levels we should have the most knowledge possible about the potential risks, and also the most knowledge about how to reduce this risk. And I think that the center can contribute to this very well, and we hope to run also on studies that might assess the level of gambling involvement in the society, either in adolescents groups and the adult population, and maybe that could be helpful to see if there's anything to do, or if we need more prevention, or any special intervention in this regard.